Hi guys, it's Al.
I'm T.
Welcome to Al and T.
So today we're going to do another.
We're going to do another introduction. This is the first. This is one of many introductions that we've done, but this is going to be the one that we actually post because it's 2020 and we're not gonna delay in 2020. But okay, let's introduce ourselves. You go first. Your life is more interesting than mine.
No, it's not. Can you? We're wasting time.
Okay, so
Thank you.
My name's Ala. I'm 21 years old and I'm an undergrad. I just did my undergrad in biomedical sciences and that was tough. And now I'm doing my master's in global health at this university.
Can you please mention what you did for your undergrad as well, for your research, because that's really interesting.
Okay. Well, for my undergrad dissertation, me, a whole scientist, was investigating the use of bioartificial livers, and I was doing a biomaterials project. So I was investigating the use of different polymers and their properties in, obtaining hepatocytes and permitting Stop it! So basically, I took a load of liver cells, hepatocytes, and I embedded them in different types of polymers that I created myself. They're called cryogels. And I was just testing to see the bioavailability of the hepatocytes and the activity of the hepatocytes. But yeah, that was hugely scientific and it was quite interesting. But I'm glad that I'm doing global health masters now because I haven't set foot in a lab for a year and I've never felt so great.
Okay. Hi guys, I'm Trey. I'm a physiotherapist from Malawi.
But see, I told you it was more interesting.
No, I did my 5-year undergrad and I worked for 2 years. That's why I'm many years older than her.
You're not many years older than me. She's 2 years older than me.
It doesn't matter. But I'm doing my master's in global health now.
Yeah, she came to the UK to meet me and to do this master's, and then it was history. Do you know what I mean? But we've been at the masters since September. This girl since November.
October, man.
October, okay. But it's been we've gone through half of our masters now. We've gone through one semester.
We're halfway there. Sorry.
Take my hand. We'll make it, I swear.
So, we're going to do a few questions. Question 1, she needs to control, guys.
No, wait.
Question 1
we're going to tell you guys just about our course in general first.
Yeah, all right. Okay.
So, we're doing a master's in global health.
1 year.
1 year master's, full-time. Our course consists of 3 semesters. The first 2 semesters we're taught modules, and the third semester it's our dissertation. So our course actually runs from September to September. So if all my friends are talking about summer, I'm just... What summer?
We don't know what that is.
I'm going to be at a computer in this library here.
Being can you keep it down? My dissertation is due in 2 days.
Insert bleeper.
Inside joke.
Anyway,
so.
September, we've done the first term. And we did 3 modules. This term was ridiculously intense. I felt like I was back in school.
It was mad.
It was crazy. Even with my dissertation in my bachelor's, it didn't feel as intense as this first term did.
Yeah.
We had lectures 3 days a week.
But it felt like 6 days a week.
So
basically, what you do for each lecture is they give you the pre-reading list, which you're meant to read.
Yeah.
And then you have the actual lectures, you have a seminar, you have workshops here
and
and
you have extra reading.
And then you have extra reading.
Yeah.
Which you're meant to read for the actual exam.
And it's you think the essential reading is going to be, I don't know, 1 or 2 papers. It's a whole A4 sheet worth of different papers articles and books and websites and videos that are 30 minutes long.
It's long.
But
it's a lot.
It's long, but it's interesting at the end of the day. And you see the benefit of you doing the work.
Yeah. And I feel like it's one of those things that if you want to do a master's in global health or a master's in general, you have to make sure that you're doing something you enjoy.
Oh my God.
Because at the end of the day, it's the passion that keeps you going.
Because I don't think that there's any assessment that I've hated doing.
Yeah.
I just don't, this is just doing the work. Yeah. But nothing that I thought I don't what is this? Why are we getting asked this? How is this relevant to me? Everything makes sense.
And I like the fact that they give you, for the global burden of management. And I can never say this. Global management of burden.
Global burden. No, global Global burden and management of disease.
Yes, that one. they gave. Is that the one we got exams for?
Yeah, we had
no.
an exam.
Okay. We have like.
We had an exam and a presentation.
Oh yeah.
Okay, wait. So we had 3 modules this semester. The first one was global health principles.
Yeah.
The second one was global burden and management of the disease. The third one was research in global context. So the first one, global health principles, was generally looking at what global health was in general.
Global justice.
Yeah, and the history of global health. Just
factors.
literally, we started off at what is global health, what's global governance, responsibility, and then we went into like deeper, more specific subjects after that. For example, like gender and like poverty, end of life care. So it was just getting a general picture of global health internationally and seeing how everything was like linked in. And like personally, I didn't know what global health was, but I didn't fully understand it. But the global health.
I thought I knew what global health was, and then I got into it. I'm like, okay.
You thought, but yeah,
that one was assessed with an essay and a poster that you had to. You literally had. I love how you could choose whatever you wanted.
It was so amazing. Like they gave us they were like literally think of any topic that links to global health, and you have to
just
pick.
Make sure you include.
You have to pick like 3 determinant like off this huge list, and that was only a small part of it as well. So they really gave us a choice in tailoring it to suit what we wanted to learn and stuff we were interested in.
Despite us picking our own topic,
we were still cramming before the exam, before the like essay. Like no matter how much you prepare yourself, you will always still be there.
Yeah. But that's because on top of doing this, you're also doing this, you're also doing that.
Yeah.
So it's really hard.
But,
and then the global
burden of disease, we had 1 exam and 1 presentation. I really liked those 2 self-assessment ways. Like I liked that they gave us an exam, but they didn't give us coursework as well. They gave us an exam and something.
I presented on the use of DDT in malaria control.
She taught me a lot. Like I know a lot about. She taught me so much that there was a question in the exam about malaria and her research. I was
that question. I was like, I was there like, guys, for the exam, I said there are over 100,000 species of malaria. There are 430,000. I said over 100,000. Is that not the same thing?
But it's also the same as saying there are over 1,000. There's over 1.
No. There is. It's not a lie.
Yeah, but
I can't say it's
you
wrong.
need to be more specific, so I can understand that. But
anyways.
She presented about DDT and the effectiveness of it and whether it should be continued.
Evaluating the use,
I learned about really DDT resistance and the need for new malaria, like preventative interventions. That's
what did you present?
I did a very, very interesting presentation on honor-based violence and different strategies to combat honor-based violence. I don't even know why I chose that topic. Oh no, we had to use a list. They gave us a list of like 10 topic questions.
Was it not 20?
Or 20? Yeah. But it was really comprehensive. There was so much stuff and like...
and we had to pick 3. I got my 3rd choice.
I got my first one.
Cool.
Anyway, but the exam, what do we have to do in the exam? We had to answer 2 questions. 2 essay questions, and it was alright. Like the exam, I was just scared because we had to learn about a lot of different topics, and only 3 of them were going to come up. I spent the night before
learning about maternal health in Peru and
what questions even came up?
Nothing.
Disease eradication?
Yeah, it was burden of diseases
and
NCDs, I think, and something
I know
else.
What I did.
I know what I did as well.
I don't know, but thank God that at least I did not fail.
So, why did you choose
research in global context? That one is to do with our dissertation. That one is the annoying one because you have to do it continuously throughout your like course, and the lectures that we're given are really like long. And it's stuff that we need to know. But do I really need a 3-hour lecture on how to use SPSS?
That was the
No, because like the lecturer tried to make it so fun, he really tried,
like, and like you can feel the passion.
Yeah, I could feel it, and I was trying, and I was, but like I just hate learning about statistics.
It was literally, it's not you, it's me. Oh, it's fine. We're on like 8 minutes now.
It doesn't matter because it's a YouTube video.
Yeah, I don't want it to be too
This is
long.
our only introduction about global health.
Okay,
So this is a separate video.
make it 15 minutes maximum.
Okay.
So, why did you choose to do global health?
Personally, I chose global health because, okay, so I didn't really consider any science before. When I was doing my bachelor's, I didn't really consider any science apart from science. I thought that social sciences were a bit like irrelevant, even though my sister studies psychology. But after like, I don't actually know what made me want to study. I don't know why I talk so much because I don't know. But it was just one of my friends or someone that I know. They were just making me think about the stuff that I wanted to do, but on a larger scale. So I've always wanted to impact health. I've known that, and I thought the best way to do it was to be a doctor and to be within a hospital. But I realized that with the help of this friend, I realized that you can make a bigger impact in policy and in like community changes and national changes. So that's why I wanted to understand about global health and understand how everything links together. And how like internationally we're all gonna develop and how we can help. And also I want to help Africa,
The motherland.
Why did you choose global health all the way in Malawi?
I picked global health
Because I wanted to come to England.
No, I feel like there are other countries that offer the same course and cheaper.
So we need to do a whole other video about the money.
But I heard about global health when I was in like my final year of uni, and I got the chance to go to summer school in the Netherlands on global health, and that was really fun.
I didn't know about that.
Oh, yeah, now you do. Yeah, so when I got there, we were talking about literally everything that I'm learning now is what we covered. But it was literally just telling you, oh, so in global health, there's global mental health. And that was it. With like a 20-minute workshop on that with your fellow undergrad students who don't even know what global health really is. But that sparked an interest in me. And I like the fact that we work in the bigger context. It's beyond the one-to-one patient contact. You're looking at societies, you're looking at countries, you're looking at the universe, and not just public health, which is basically communities. You're looking at something that's beyond one person and beyond one country. And that's what I really love about it.
And I think with the increased globalization and interconnectivity of the world, we can't really be looking at things at a small scale, because we can't just be thinking about England's public health when the borders, everyone's coming from every other country and they're bringing every other disease.
And we're going to get other diseases.
And we're coming back too.
Exactly. So there's
and we're going to go give people diseases that they don't have. So we just need to understand how everything flows really and how everyone connects.
Yeah.
Where do you see yourself in 5 years, Gift?
In 5 years, I'll be doing my PhD.
Ooh, what would you be doing in HIV?
No. Actually, I'm very interested in HIV, guys. I did my undergrad research in HIV.
Well, what do you think you'll be doing it?
But I think I'll be doing it on more access to not access to medicine, but access to health in general. Like access to health, especially for the vulnerable communities.
Would you be doing that in Malawi?
No, babe. Don't even think they have PhDs like that in Malawi.
Come now, don't put that badness on Malawi.
It's not bad. I'm just saying we don't have.
You don't have
enough
PhD?
people. No, we have PhDs, just not in access to health.
Okay.
Yeah, that's what I'm saying. And mostly on the vulnerable communities, like the homeless, the people living in poverty, and the marginalized. That's what I would want to do my PhD in. Where do you see yourself in 5 years?
I could also see myself doing a PhD, but I would like to be working within. I would like to be working as like a anthropological global health consultant. Kind of.
Me, guys.
So I feel like really, I really enjoy anthropology now. I didn't think I would, but I do like it a lot, especially.
I have to do anthropology on mental
health.
health and stuff, and I'm like,
I'm excited.
I have to.
She picked it.
All the other options were so depressing.
You should have picked
Did
conflict
you know?
and violence.
Did you know that we spend about $8 trillion on domestic violence?
Yeah.
Like I can't do it. No, I can't sit there and listen to something like that.
But you need to know about it because it's such a pressing issue.
It is, but it's so sad.
So you don't want to deal with it.
I do want to deal with it.
Someone else can deal with that bad issue.
But no.
So much stuff is sad. Learning about HIV is sad.
Not really.
Learning about what do you want to do? Marginalized. Access to medication is depressing.
The thing is, I want to look at solutions to make sure they have access to healthcare.
So you want to make effective interventions.
Exactly. Implementation.
But you also need to face the sadness, you know, face the bad things.
What's your biggest research interest?
Okay, me, I think we should actually change that question and do what's your research now?
Okay, what's your research topic?
So guys,
Hers is so interesting and she's so
guys, I'm so excited. Okay, so I'm studying stigma. I'm studying the stigma that's perpetuated within mycetoma sufferers in Sudan. I'm looking to study it within a local context, but the stuff and the tools and things that I produce can be used globally, and they can be transferred into other diseases, kind of thing. So mycetoma is a highly stigmatizing skin condition, and a lot of people in Sudan suffer with it, and there's a lot of stigma perpetuated around people that have mycetoma because you can literally see it and people think they're going to get it and people aren't really educated about it. So I'm going to go to hopefully I'm going to go to Sudan, and I'm going to produce, develop and administer a mycetoma stigma scale that I produced myself with the help of some previous publications from the University of Brighton. But yeah, it's like a 32-point scale, and I'm going to give it to some mycetoma sufferers in Sudan. I'm going to collect some data to hopefully validate the scale, and also I want to be able to identify which stigma people think they're going to feel and which stigma people actually feel. And
so it's a perceived stigma
felt stigma.
Okay.
Because a lot, like the main research just says stigma in general, but there's like two different types of what you think and what you're going to do. And also I'm going to look at it as specifically like an intersectional point of view, because
intersectionality is amazing.
It's amazing. Because women are disproportionately affected with all NTDs in general because of a number of social, cultural and biological factors. And there's a real gap in understanding why, like the impact this has on women, and there's a huge gap in understanding like stigma and intersectionality, because obviously women are going to be highly stigmatized for having this disorder because it's so visible, but we don't really understand to what level, and we don't understand what this causes inherently. So I'm just trying to disentangle that, and I'll get back to you and I'll let you guys know.
Mine is not as fancy, but I'm doing a systematic review. I'm looking at I'm also doing NTDs. I'm looking at how we can better integrate the management of NTDs with other existing healthcare interventions. So like I said previously, that I'm really interested in access to health for the marginalized people. So NTDs mostly affect like the poorest of the poor communities, and I'm looking at how we can use our limited resources that we have into managing and controlling NTDs. So I'll publish it, and I'm also looking at the strategy that the WHO are implementing and see if they're really working from like my outside perspective.
So you're going to provide sort of recommendations?
Basically, yeah.
So you're basically doing a kind of policy analysis? Yes!
We love policy analysis.
If you guys want, we can do like just updates as we go along.
Oh, yeah.
Because we're doing two very different types of studies. We're doing two very different types of studies, so it might be useful to see how like primary research is conducted. Because oh my god, I'm crying. The ethics that I have to go through and don't even
miss me with that. Sorry.
She's doing a systematic review. So yeah.
Highlight of your masters so far.
Okay, let me think. I think I have like two highlights. One of them has probably got to be meeting my little soulmate here. She's older than me, but my little soulmate, because she's shorter than me.
Wow.
But anyway,
you can't see that on camera.
It's been really nice to meet someone from a different perspective and a different like kind of world, and then come together and we're just so similar.
Yeah, it's
and
weird.
It's just like
it's so weird.
Hanging out with yourself, but a more annoying version of yourself. And a little bit of a version of yourself that's gonna tell you when you're being annoying and tell you to shut up. But anyway, and the other one is the Christmas dinner that we had.
How are you stealing?
Okay, anyway, I guess it's both of our highlights.
Yeah.
We, as course rep, I organised the Christmas dinner.
No, okay. So basically, I like things. So I was like, hey guys, since we all like each other in this class, can we do Secret Santa?
Yeah, we did that.
Anyways,
and she had the idea, but we organised it together. I mean, we didn't. Anyway,
she organised.
We went to
it,
Christmas dinner at this place, and we had
the
basically the whole
class.
place to ourselves. The whole class was there, and everyone was just chilling. And it was so fun, and we all got Secret Santa presents, and I got a lava, and I've always wanted a lava lamp. And it was her.
Whose idea was it?
But she wasn't even my Secret Santa. It was someone else, but she told us how great.
Yeah, so basically, the fact that the class is so small, because we're like 17 people in our class, we get to spend a lot of time together. Well, not anymore, because now we're splitting.
Split up.
What are you majoring again? She's doing conflicts and violence.
Anthropology of fertility.
And anthropology of fertility. I'm doing... What am I doing again? I'm doing health and development and anthropology of mental health. And
but I think it's cool because I'll actually I want to know about what it'd be interesting.
Yeah, so
to
we'll
know.
be teaching each other what we're learning.
Because I'm gonna be like, you don't want to learn about conflict and violence. Well,
and that's what we always do. Tip, guys, for your masters, find a buddy. Makes life so much easier. And someone you can call like at midnight before deadline.
Yeah, literally. Oh my god, did I do this right? Did you resubmit it, by the way?
Yeah, I did.
Okay, that's good. I didn't know you were gonna have to resubmit.
Yeah, I did.
That's great. But anyway, guys, that was just a brief 20 minutes. But
sorry. No, we won't even cut it, man.
No, I'll try. I'll see.
Okay.
But anyway, we'll see. But yeah, thank you for listening to us during on. We hope this is beneficial for you. Someone out there.
Helpful.
If you want to study global health or public health.
Bye. Not just public and global, if you want to do your masters.
Bye.